Good evening. Am I being heard?
I can hear you loud and clear, Lydia.
We can hear you.
Thank you very much. My name is Lydia.
Is your camera on, Lydia? Your camera is on?
Yes, it is on. Can you hear? Can you see me?
Yes, I can see you, Dr. Okutoyi.
Great. Like Loretta, I'm a gynecologist, and I work at a national hospital. In the recent past, I've not practiced as a gynecologist much. My heart has been sold out to system strengthening at the hospital level. So I'm a director at Healthcare Quality, which has patient safety and process improvement, IPC, and patient-centered units. So we are about 5 units that support to me. So that is at Kenyatta, and so I have the privilege of being able to support a 2,000-bed capacity hospital on matters just mainstreaming that care is responsive and that it is safe and that it is effective. So when I come to patient safety, it is a pet topic because during the last about 5 years, we have implemented our medical error reporting systems, and we continue supporting a culture of safety in that where are we able to discuss openly, talk about openness and an non-punitive culture, and be able to have the frontline healthcare worker know that it is them who translate the safety. And so if there are any opportunities to standardize, to give guidance, to develop a general, the system-related SOPs, not the specific discipline-related, for the purpose of ensuring that care is safe. We have attempted to do that. We hope that we are getting safer, and from the statistics and from what we see, we can say that it is an effort that everybody needs to really put their hands on, because even counting or quantifying how care is safe is a journey of how African hospitals can be able to count and quantify, looking at never events, serious reportable events, just developing communication protocols. It has been a journey that I think, just to wrap up for the purpose of Kenyatta, it's been, it's created my career because it's been challenging, but at the same time meaningful, because we don't work hierarchical, but we work horizontally across departments, creating relationships, meaning and value, investigating incidents and being able to learn from them. And at the same time, allowing the leadership in that area take responsibility in ensuring that there is learning happening, that there's a culture of learning. And so that is the privilege I've had in Kenyatta. The other group that I've worked with is Acquire, African Consortium for Quality Improvement Research among frontline healthcare workers. It's a small group, but it's given us opportunity to work in Ethiopia, in Cameroon, and in Kenya, mostly among mission hospitals, because one of our strong directors is from the mission hospitals, Christian mission hospitals related side. And so we've gotten a few grants to just support QI initiatives, and safety being one of the pet topics. And so we look forward to doing a curriculum for Cameroon for a facility called Mbingo. We've already done a draft, and that is all in line with the global patient safety goals. We hope that that will support the leadership in ensuring that care is safe and that they can have QI as part of what they do. And I'm very privileged that Isemide has mentioned Michael Dakin. So Kenya is part of the countries that are in the global patient safety network. So Kenya, together with other countries, I think Ethiopia is also part of them, and Sudan, they are part of this a flagship program of some support to the country office, to the patient safety MOH team, and how they can implement the global patient safety action plan. And so we've had the support, and during COVID, we developed the patient safety and the quality healthcare national policy. So it was just launched last patient safety day. That was last year on 16th of September. So we had our national document, a very great moment that the document is out, and now we need to walk the talk. So we are developing modules to train healthcare workers on patient safety, and that actually is hot in the oven. It's happening the last 2 weeks. MOH has been meeting with partners to develop the modules so that we can have the counties supported. Kenya, like Nigeria, is a devolved state. We have devolved government units, and so they need guidance from the national government. And so the Global Patient Safety Network group, where the Imperial College in the UK is the academic partner for WHO, in that regard, have been giving us support. And so it is a journey that we hope it will mainstream the language. Safety is also a specific discipline. You need to be able to relate, to count. You need to be able to know how you're doing and what skills to use and what leadership approaches. And so we hope the module will help the devolved states be able to take up specific actions that will enable them to have care safer there. And we're excited about the Global Patient Safety Action Plan, because for a long time, Africa has been known as a place where when you talk of safety, we are only talking about hand hygiene and IPC, and that cannot be underscored. It is important to wash your hands. It is important to make sure there are no infections that are being crossed from patient to patient or to staff or to the formites in the hospitals. However, this enabled us to address other topics that are really needed, resilience, and just how much we are able to make care safe amidst our challenges as Africa. Because always in some district hospital somewhere in remote Nigeria or remote Kenya, it is a matter of trying to improvise ABCD. So how do we improvise and still keep it safe? And so we are ripe as a continent to have the discussion around the action plan, because our situation is a little different. However, we are improving. And given that we have technology at the same speed as the West, meaning we can improve faster. And so I'm truly hopeful that Dr. Semide bringing us together will spur some direction towards fastening, making this faster, that we are able to make every mother coming through that delivery room in Africa have safe care, have a safe delivery, have a good quality baby, and ensure that big things like maternal mortality in our continent are reduced, addressing this from multiple levels, from the front line to the systems to the policy level. And so I'm really glad to be part of this team. Thank you very much. Back to the chair.
Thank you very much, Lydia. That's lovely to hear from Kenya.